Question of the day. The nurse receives a report on 4 patients. Which patient should the nurse assess first? A patient with COPD and an O2 sat of 89% on 2 liters of nasal cannula. B, a post-op hip replacement patient reported new onset calf pain and swelling. C, a patient with a heart failure who gained 2 pounds overnight. D, a patient with a fasting blood sugar of 210. Pause the video, pick your answer, then come back and see if you're right. All right, let's work through this. And I'm not just going to tell you the answer, I'm going to show you how to think through it so you can answer any priority question. Start with D, fasting blood sugar of 210. That's elevated, but is it an emergency? 210 is high, but it's not DKA territory. The patient isn't in crisis. They need medication adjustment and monitoring, but they're stable right now. So you would eliminate D. Now let's look at A COPD patient with an O2 sat of 89% on 2 liters. This is where more students get trapped. You see 89% and think, that's too low. They need more oxygen. But what did we learn about COPD patients? Their target O2 is 88 to 92%. And 89% on 2 liters for a COPD patient is within their therapeutic range. They're right where they should be. This patient is actually stable, so you would eliminate A. Now, if you picked A, you fell for the trap. Now C, a heart failure patient who gained 2 pounds overnight. That is concerning, but a 2-pound gain means roughly 1 liter of fluid retention. This means that it needs attention. You're probably going to adjust their water pills, right? Their diuretics. You're going to check their sodium, and you're going to reassess their fluid intake. This is an expected finding in heart failure management, though. It's chronic. It's being monitored. Is it an emergency right now? Not necessarily, so you would eliminate C. That leaves us with B, a post-op hip replacement patient with new onset calf pain and swelling. Now, why is this important? This is your answer, and here's exactly why. This patient just had hip surgery. They've been immobile. Think back to Vicro's triad from the Clot to Crisis series, right? Immobility causes venous stasis, right? Surgery causes endothelial injury. The stress response causes hypercoagulability. All 3 risk factors are present. Now they have new calf pain and swelling in one leg. That's a textbook DVT presentation. And a DVT in a post-op patient can break loose and become a pulmonary embolism. And that's immediately life-threatening. So this is the priority because 2 frameworks working together, right? Acute over chronic, and the other 3 patients have ongoing conditions being managed. Patient B has a new change, a new onset, right? And it's directed to ABCs. If that DVT becomes a PE, it's a circulation and breathing emergency. You're not treating a PE yet, but you're preventing one by catching the DVT now. Here's an NCLEX tip. When NCLEX gives you 4 patients, look for the one with a new and unexpected finding, especially when it could lead to something immediately dangerous. Now, stable patients with expected findings can always wait. A new finding in a high-risk patient cannot. Here's the memory trick. New and changing beats old and stable. You learned this in the prioritization video. Patient B is the only one who's changing. Everyone else is at their baseline. The answer is B. Did you get it right? Drop the answer in the comments. Be honest. If you picked A, don't worry. That's the most common wrong answer. And now you know exactly why it is a trap. Save this. I'm going to start to do these every week. So follow so you don't miss the next question of the day. Think like a nurse, pass like a nurse. Happy studying.